So first of all, thank you very much, Clara and Erika, for organizing this and for inviting me to speak. And then I would like to confess first that firstly, we have heard that people think that there are several diseases that affect animals. And although I respect that statement, my strong belief is that there is only one disease, and that disease is African swine fever. And that's what I'm going to talk about. And the second confession is that I have never worked with participatory epidemiology. So my long arm in that field is Erika. So many of the slides that I will show are actually hers. But anyway. So what I wanted to do is to because I've been working in Uganda since 2009. I've been there for a longer period, and then I've been there every year, and I've had the students working there, and Erika was there and did her PhD. So we'll take her through some of the experiences we've had and what we have learned during this process, and why then we have understood that we need to maybe take another approach and include social scientists, and then briefly tell you about the new project that we have. So the disease, the disease that I believe in, it affects pigs of different kinds, normal domestic pigs, wild boar, European wild boar, and then it has a natural reservoir in Eastern and Southern Africa, and that is the warthog. It kills pigs. It causes a hemorrhagic fever, normally with typically very acute and with high mortality or lethality. And you will see these hemorrhages or discolorations of the skin in typical cases if the pigs are of white-skinned pigs, and you will find hemorrhages in the tissues. And most of the virus will actually be in the blood. So blood is what infects most efficiently. The disease has no preventive measures except biosecurity. There is no vaccine. There is no cure. So one of the main factors of the success of this disease is its capacity to persist in the environment, and especially in meat. It actually survives in pork, contaminated pork in a fridge for, here it says, in room temperature, 2 weeks, in a fridge, 150 days. In cured products such as, this is a serrano ham, it can persist, it can survive in many, many months. And also in blood, it survives for a long time. And this is a dead carcass of a wild boar, which also persists in the environment. If you look at the epidemiology, how this disease is spread around, it has 4 cycles that can be separated. This one is the ancient cycle in Africa where you had the warthog and the tick, so it was a tick-borne disease. There was also a player called bush pig, which might or might not be involved. Then there is another cycle described with tick and domestic pigs. And then there is this one, which we will talk about, where you have pigs and pig products. So it spreads from pig to pig. And then there is the last one that was described in a paper by Erika last year, where you have the wild boar and the environment. And that is what is currently affecting Eastern Europe. But we will talk about this, where we have pigs, diseased pigs, healthy pigs, pork products, and more importantly than anything else, the human being. So we wanted to look, we started out one of the early studies up in Northern Uganda. It was a master study, a Swedish student. She wanted to investigate the dynamics of African swine fever and identify the routes of transmission, and to look at mortality. So we were working up, this is Uganda, this is Gulu district in northern Uganda, a district that has been affected by war, civil war during many, many years. We were there in 2011, so they had 5 years of peace, where slowly coming back to normality after maybe 20 years living in camps. This map shows the district, and here you see the dots. These dots represent outbreaks. So they went around interviewing people in these villages where they had outbreaks, and to try to identify how did the virus enter this village. So this is what the route of spread that they could identify in this way. They started out in an international or a camp for internally displaced refugees. In this camp, they had a boar. They got an outbreak in that of African swine fever in that village. But before that was recognized, they lent the boar to the next village, in village B, because they didn't have any boar. And actually, when they got that outbreak, that was the first time when because at that time I had been in Uganda for 6 months trying to locate these outbreaks to see a pig that suffered from African swine fever. Because if you work with diseases, you really want to see sick animals. But it was not easy because reporting is often delayed. So when you come to a village, generally all pigs are dead, or the ones that have survived have been sold and slaughtered. The ones that died of disease might have been eaten up. So in this village, we told them, please keep one pig for us so that we can test and confirm. So we drove from Gulu and came there after several hours, and we felt the smell of barbecue. So because I came with my partner from the university, but also with the authorities, the district veterinary officer, and we realized when we arrived that they feared that we would take this carcass from them because it was sick. So they ate it up. But they saved a very small piece of the spleen. It was hanging up in one of these huts, clay huts, in the roof. They hang in a small jar. So we got it, and we could confirm the African swine fever. So what happens when you get outbreak in a village? You have a lot of pigs that die. You have an increased supply of meat, because normally you don't slaughter your pigs. And so the tendency, at least what they say, is the price goes down. This is the periphery. This is a marketplace, village C. So when pigs die in village B, the butchers come from village C and they buy these cheap pigs. So they bring the disease to the next village, and it continues like that. So you have an increased supply of pork. Either people come from the next trading center, or the families in this village will donate or give away pork to their family members, and they will spread the disease from the periphery to the trading centers and up to Gulu, which is the center of this district. So through carcasses, through meat, through skin. This is, of course, only based on interview studies. So we don't have there is no evidence that this was actually a chain, but it fits very nicely both in the story, but also in the timing of these events. And it also is very similar to what is seen in other countries. Exactly the same have been seen in Russia, studies in Russia, where you see that spread goes from the periphery to the center through the market chain. So if you look on pictures, you can see a deceased pig. It's being put on a truck. It's being slaughtered. Leftovers are left on the ground, and these leftovers contain a lot of virus, and they are given to dogs. And the dogs, they pull them around in the environment and contaminating the environment. This is the meat. This is the meat that is then given which is eaten, and it's given to friends and relatives. In that way, spreading the disease. So this is a very efficient way of spreading infectious diseases through humans. And this is nothing new, because this was known a long time ago, This is the first publication about African swine fever from 1920, where already then Montgomery, who was a veterinary doctor in Kenya, he understood very well most of the peculiarities of this disease. And he also stated that, in principle, this disease should be preventable. It should be possible to control it, because we know enough. And Erika also believes in that statement, and I also believe in that. But we see that it doesn't work that easily. So in one of Erika's studies, she wanted to understand, or we wanted to understand, what does the farmers know? Because normally you say that farmers, the knowledge is not enough. They don't have the knowledge to prevent. So this is a series of PRAs targeting farmers and other stakeholders, and they could be here value chain actors. They could be traders or butchers, for example, looking at knowledge, attitudes, and practices towards African swine fever, and also control, and also to better understand drivers of spread and constraints for control. And also looked at, this is the result from the first interview study, where you looked at how did the farmers or stakeholders perceive the disease. These are the statements that, or the wording they have used, that it created deeper poverty, loss of income, lost hope, fear of new outbreaks, jealousy, loss of school fees or inability to pay school fees. It affected diet, human health, and agricultural production. So these are the perceived impacts. Then if you try to measure these impacts in a quantitative way, it's really, really difficult, because it's a system with very, very low input and very, very low output. So in the studies that came after, it was hard to really show these effects. So it's perceptions, but the effect is there in some way. So when the farmers were asked to describe clinical signs, I mean, they could describe most of the common signs. So they know how a pig that dies in African swine fever, how it behaves. And this is not only the farmer, but also the butcher can say that this is African swine fever, and the trader, he can say it. And if you ask about spread, they also can identify the main routes of spread. There are some things that are not correct, like African swine fever is not airborne, but most of these are very correct. So they know about the disease, they can identify the disease, they know how it spreads. They know something about control measures. They can mention, or they can do a list of control measures that in principle could be efficient. They can also say that they know of much more than what they actually implement. And when you ask the farmers and the traders and butchers whether or not they have sold pigs or products that they knew were infected, they also say yes. Almost half said, yeah, I've done that. I've sold sick pigs, and 71 said that we have sold infected products. Because, of course, in a situation in Western Europe, like we have in Sweden, if we have an outbreak of a disease like this, there will be interventions by the government and the states, but each farmer and each producer will have a compensation. Here is no compensation scheme in Uganda, so in order to save whatever they can save, they have to sell the pigs and products as soon as they can. And this, of course, promotes spread. So we are here in a, so what are the conclusions we can draw? We're in an area that is severely affected with African swine fever. The farmers have knowledge about the disease. They consider this disease a major constraint with significant impact. They have some knowledge about possible control. There is no implementation. All actors are realize that they are involved in the spread. Yeah, they are involved in the spread and they are aware of it. So this is why we now in the new project in the proposal we said that the major challenge in controlling African swine fever and reducing the impact is not necessarily technical. It's not related to the biology of the virus or the host, but it rather relates to the specific needs and circumstances of the producers. So, or not only the producers, it's also all the stakeholders. So, and this is not only in Uganda. This could be translated to any place, Sweden probably. So in a context where pig production is dominated by low input, low output systems, mostly involving poor marginalized groups, feasible low-cost control options fully adapted to the local context and highly accepted are required. And we came up with a study. So we approached the Department of Rural Development and Clara Fischer, and we applied for funding, and we got some funding, and we want to. So this is a project that should have started this year, but it's merely starting now. We have. So it's actually the first time we really collaborate in a larger project with the social scientists, and we really look forward to this. And we want to do a study on the implementation of control. So not looking at the control per se, but on the implementation step. What are the factors that affect the success versus failure of the implementation? So, and doing a participatory identification of interventions, not using the conventional interventions strategies, but deciding on the interventions together, and then assessing this in a longitudinal way. And the other study is an ethnographic field study, so an anthropological study. And we have Anna Arvidsson, who will be our PhD student, and she sits here. And she will go with us to Uganda on Monday to visit these smallholder farmers and to visit the pigs. And she will spend time in one of these villages during 5, 6, 7, 8 months. And that will be very interesting to see how much further we can come in understanding the disease and the interplay between the animals and the humans and the control in these local contexts. And this is the project group now. We're from Sweden. We're Susanna, so almost many of the speakers today, Sanna, Clara, Erika, and then Anna and me. And then we have in Uganda, we have partners from Makerere University, Juliet Chiguli, who is a social scientist, and Charles Masembo, who is a veterinarian. So we'll see how that goes. And meanwhile, we can just say that meanwhile the human mediated spread, it continues because of the situation in Africa and Uganda. The virus escaped the continent in 2007. It came to Georgia. It spread with the help of humans through Georgia to Armenia, Azerbaijan, Russian Federation, Belarus, Ukraine. It came to Lithuania with humans. It came to Poland with humans. It came to Latvia, Estonia, Moldavia, Romania, Czech Republic, Hungary, Bulgaria, Belgium. That was a scare for the European Union because it's too close to Brussels. And then China, where they have 25% or 25% of the global pigs population. So they have this disease as well. And I'm sure they will have the same problem as in Uganda or even worse. So we'll see how that continues from next year. So we can bet on which country will be the next one. So that's all for me.
If you have a question for Karl, you can take it now while I find the mic for Paul. Yes?
Is there a willingness among the Ugandan government to stamp out a disease outbreak? Is there the possibility of doing that? And would that have been successful if they had swooped in and done what we would have done in European countries?
No. There is there is no willingness, or in principle there could be a willingness. I think even they have that possibility according to their legislation. The legislation is based on English legislation from the 20s. So they have a quarantine system. They have a possibility to stamp out. They have a possibility to compensate, but they don't have the means. Culling means that you have to be there on the spot. You have to have a notification system. You have to be quick. You have to react. You can't react when the disease is already all over the country. I think the main constraint is the time delay, the lack of timeliness. But also, it's different when you have a disease that is actually endemic. It's like BVDV so we see it as an exotic disease, but it's not exotic here. It's everywhere. So you have to treat it in a different way.